Hello, everybody that's on here. We're going to go ahead and give another minute or two just for anybody who may be arriving a little bit late. So we'll get started in just a minute or so. Can everybody hear me okay? Should play some tunes or something. I mean, I guess we could go ahead and get started. It looks like almost everybody's here. So we may have a latecomer jump on, but that's fine. Okay. So I wanna welcome everybody for being here. Please let me know in the questions or the chat if you have a hard time hearing me or anything like that. I also want to introduce myself, of course. My name is Hope Hillman. I am the marketing director here at Shine Ernst Mishra Eye. And of course, I have Dr. Mishra with me also today, and he will be doing your presentation and possibly your LASIK. So without further ado, I just wanted to mention a couple of things. First, I want to encourage you to ask as many questions as you want. So go ahead and start typing those into the question box now. We're going to leave a whole bunch of time at the end for you to ask any questions or answer any questions you may have. So if anything comes up during this presentation, go ahead and type that in there, and Dr. Mishra will be answering your questions. So just please feel free to do that at any time. I also want to mention and thank you guys for coming today, just for being on the webinar. We are actually going to have a couple special offers just for you since you've joined us today. So one, we're actually going to waive your pre-op fee, which is typically $199. We're going to go ahead and waive that for you for joining us today. So that's one great thing. We've also decided today to do something extra special too. We've had a summer promotion going on this summer where we've been offering $500 off per eye. Now, we don't typically do a whole lot of discounting on our procedures. However, this was a COVID relief promotion that, the doctors really wanted to do to kind of, give people an opportunity coming off of COVID and stuff. So that is actually a promotion that we are running until, typically for the public, until September 1st. But because you've joined us today, we're actually going to extend that exclusive offer just for you until the end of September. So if you do want to schedule your surgery, we will honor that discount for you. So that's awesome. That's a really great news. We do offer financing for our procedures through Care Credit. And LASIK consultations can be scheduled on our website at any time at seegreat.net. That's SEEGREAT.net. And that'll be on like the last slide too, in case you forget it or need to write it down. But you can schedule LASIK consultations on there at any time to find out if you would be a good candidate for the procedure. I do want to quickly mention pricing because usually that's one of the first questions somebody types in. They want to know how much does it cost. So let's just go ahead and talk about that. LASIK at Shine Ernst Mishra Eye is an all laser LASIK procedure, and it is $23.99 per eye. Now that's before any discounts, insurance discounts, or promotions like the ones I just told you about. So getting a $1,000 discount right now is obviously a really good promotion that we have running. So and that price includes everything. So that'll include all laser LASIK. That will include lifetime enhancements, which we can talk further about later. And the pricing includes all of your pre-op appointments, your follow-up appointments, the doctor's time, the surgery, everything. So we'll just go ahead and put that out there. And without further ado, I guess I'll go ahead and introduce Dr. Mishra. He's been with our practice at Shiner Mishra Eye since 2006. He's done well over 1,000 LASIK surgeries and thousands of laser cataract surgeries. So without further ado, Dr. Mishra, welcome.
Thank you, Hope, and welcome to everyone on this broadcast. I'm so excited to have you join us to talk a little about LASIK. As Hope mentioned, I'm one of the LASIK surgeons at Shiner Mishra Eye, and so we're going to have a short presentation, and then we'll be here for as long as you need to answer all of your questions. So let's go ahead and get started. So first of all, who can have LASIK? Well, the good news is many people can. Most people who wear glasses for distance vision can have LASIK. And so that includes people who are nearsighted, or we call myopic. So nearsighted again means you can see up close, but far away you can't see. People who are farsighted. Farsighted people actually have difficulty seeing up close and far away. They can have LASIK. And people who have astigmatism. Definitely people who have astigmatism can have LASIK. Actually, we can correct very high amounts of astigmatism. And it's interesting, a lot of times patients come to me and tell me that, oh, I was told in the past I can't have LASIK because I have astigmatism. And that's really not true at all. We can correct lots of astigmatism, and those patients tend to be some of the happiest people out there after LASIK. One of the things that we look at is the corneal thickness and shape of the cornea of the eye. That has to be, a certain amount of tissue, a certain appropriate amount of or appropriate shape to be nice and safe. That's one of the things we look at. In terms of age, for the most part, we do LASIK on people who are approximately somewhere between ages 21 and 60. It's FDA approved after the age 18. But from a safety standpoint, it tends to be best once you're above the age 21. Of course, when you're young, your prescription can change, and so no matter what age you're at, your prescription has to be stable for at least one, preferably 2 years. And the upper range, again, the FDA did not define an upper range, so technically you can do it in your 70s and 80s, but we find that till approximately age 60 or so is where patients get the biggest benefit. After the age 60, other things such as cataracts come up. We might do cataract surgery, but we're happy to do the full consultation to see, what's best for you to individualize things. And I get all the time asked about reading glasses. So there are patients out there who all they do is wear reading glasses. They don't really have distance vision needs. And there is an option. It's this thing called monovision, one eye for distance, one eye for up close, that can be done with LASIK. And there are patients who are doing that with contact lenses already, whether they're nearsighted or farsighted. And we can build in monovision with LASIK. So that's a possibility as well. So lots of options. The fact is the vast majority of people who come to us for a consultation are LASIK candidates if they're wearing glasses or contact lenses. But one of the things that we do look at is the very specific person, the specific eye, just to make sure. So moving on. Well, what is LASIK? Well, first of all, the word LASIK is an acronym, which stands for Laser Assisted In Situ Keratomileusis. Now, those are just big fancy medical words to make us sound smart, but what it really is a procedure that is a two-step procedure. Step one, we create a flap, and then that's done with a laser. And then step two, we do the correction, and you can see in the slide here, if you can see the cursor arrow, this laser here is doing the correction. This little thing right here is the flap that we created on the surface of the eye with a laser. And then we do the second laser correction, and then we put the flap back down, and it seals kind of like a Velcro, nice and tight. And over time, it gets tighter and tighter. And so that's the procedure in a nutshell. So moving on, in terms of a preoperative exam, we do a very detailed, very extensive exam in our office. It's somewhere between 2.5 to 3 hours. You're here. You get a lot of tests done, most likely the most thorough, most in-depth eye exam you'll ever have in your life. Your eyes are dilated. That is something to be aware of. And that dilation can last till the next morning sometimes. Again, something else to be aware of. But you get a very detailed eye exam, A to Z, with lots of testing. And so then at the end of it, for sure, we'll know if you're a candidate or not. One of the things that we do at the preoperative visit and in terms of testing is this machine called the eye design. And what this eye design machine does is it uses wavefront technology to measure all the focusing problems within the eye, pretty much. So it sends this wave through the eye, and then that wave bounces back into the machine, and the machine analyzes that information. It's very detailed. It's like taking a very super duper fine fingerprint of the eye. It's more accurate than any other eye measurement system out there. And that information, once it's analyzed by the machine, we then transfer to the laser to use for your treatment. So it becomes very individualized, very accurate treatment. So we're taking that preoperative measurement and taking it to the laser. It's called the eye design. So that is one of multiple tests that you're going to get done, but one of the crucial ones. So as I mentioned earlier, when we do LASIK, we use two different lasers. So the step 1 laser that we use is called the femtosecond laser. I'll explain a little bit more of that in a minute. But the specific one that we use is called the Victus femtosecond laser. And we have that in-house. It stays on site at all times. And the machine basically looks like this. And you can't see it here, but basically underneath this space here is a bed. The patient lies down underneath this bed, and we use the machine to create that flap, that laser flap. In the old days, we used to use a metal instrument, which was good, but nowhere near as precise or accurate as this Victus femtosecond laser. And again, we have it on site. So what is a femtosecond laser? Well, it is a type of laser that is super duper fast and super duper accurate. The machine, the laser works with a separation of 1/4 of a second. So each spot that is created is 1/4 of a second apart. So that makes things very precise. And you can see in this picture right here that it creates this little bit of a grid-like pattern. And I kind of mentioned a Velcro earlier. So it creates this grid-like pattern, and this pattern is actually little air bubbles that are created by these super fast laser spots. Then once it's done in the entire cornea, it allows us to, like a Velcro, open that flap up. I'm not going to get into too much detail about this flap. I know sometimes it makes people a little queasy, but in essence, that's what it is. After that flap is created, we stand the patient up and then transfer them to laser number 2. That laser number 2 is the laser that does the correction. And you can see right here, this is the bed that you lie on for laser number 2. We use the Vizx S4 excimer laser. This is the laser that actually does the correction of the nearsightedness, farsightedness, astigmatism, etc. This is an excellent laser that we've used for a few years now and has really amazing outcomes. The vast majority of patients are very happy. So the bottom line is this laser does the correction, and at the end of it, we put that flap back down that was created, and no stitches are involved, and patients recover quite fast. And this is another laser. If you ever get a chance to visit us and see our LASIK suite, we have on site at all times. So we know it's always finely tuned for the day you guys come. So I'm going to show a little video here of the correction itself, and it's using the wavefront technology. And before I start it, if you can see on the left side here, this purple square. In that purple square, once I start the video, you'll see the red spots, and that's the red spots of the laser. On this grid-like layer here, you can see this bumpy green area, and that you could say is on the surface of the eye, the cornea, that is the quote abnormality, or the area that's going to be corrected. And without glasses or contact lenses, in a cornea that needs to be corrected, on the right here, you can see this diffuse white light. And basically, in uncorrected eye, everything is blurry. It's diffuse. And our goal is to change it so that it becomes a pinpoint, white pinpoint light. And so I'm going to start the video now. Here you go. You can see the laser spots here in red on the left. You can see the blue grid changing, flattening out. That's the correction that's happening. And you can see on the right here, the diffuse white spot becoming smaller, or diffuse white area becoming smaller and smaller. To finally, it becomes a little pinpoint of light. That's what we want. So it went from this diffuse, blurry, white, hazy thing to this nice pinpoint spot. And the cornea that was kind of bumpy before is nice and flat here now. That's the correction. Go to the next slide here. Here we go. So one of the great things about LASIK is that patients can see better pretty quickly. Within 24 to 48 hours, patients see much better. So what I'd like to tell patients is that in the beginning, there is a big change within the first 1 or 2 days. And then over the full 1 year of healing, slow, steady, subtle improvement. So a big change in the beginning, and then slow, steady, subtle improvements over 1 year. When you go home on the day of the procedure, it is kind of blurry, like you're swimming underwater. But by the next morning, it's definitely quite a bit better, and every day after that gets better. You take some medicated, some prescription eye drops for about a week, and there are some restrictions, not too many, but there's a few restrictions for 1 week as well. So this slide kind of summarizes the week of LASIK. So if we go here to the left on Monday, so I usually do my preoperative visits on Mondays. If you see Dr. Ernst, he usually does his on Tuesdays. Now, before you come see us, if you are wearing contact lenses, depending on the contact lens type, you're going to be out of them for at least 2 weeks, and perhaps longer if you're wearing RGB contact lenses. But that Monday visit is where you get that extensive testing, as well as you get to see myself or Dr. Ernst, the LASIK surgeon, and we do the full examination, as well as answer all your questions. And then LASIK itself is usually done on a Thursday. The procedure, Dr. Ernst usually does in the morning, I usually do in the afternoon, and then you go home pretty much right away. After we give you all the instructions, you're there maybe an hour and 15 minutes, an hour and a half on the day of LASIK surgery. And then follow-ups basically occur 1 day, meaning the next day. So we would see you on Friday, and then 1 week, 1 month, 3 months, 6 months, and 12 months. Now, if you're going to be having the care, the post-operative care with us, Dr. Ernst or myself, we'll be seeing you for sure 1 day after the procedure. If you have a referring optometrist, frequently patients want to go back to the referring optometrist, and that doctor will see you the 1 week, 1 month, 3 months, 6 months, 12 months after the procedure. And if additional visits are needed, then those are all included within the price you pay, so you don't have to feel like you can't come in. We always like to make sure you have full access to us, whether it's on a weekday evening or weekend. But in terms of the standard visits, that's what happens. As I mentioned, healing occurs over the full year. Big change in the beginning, and then over the 1 full year, slow, steady, subtle improvements. Around the 3-month mark, it's pretty close to where it's going to be, but still 1 full year of healing. So that's it for our presentation portion of this broadcast. I do want to thank everyone again for being on with us. I also want to take the opportunity to thank Hope Hillman and the rest of her team for putting this this evening together. Thank you so much. So at this point, I'm going to just turn it back over to Hope, and I'm happy to answer all of your questions. Thank you.
I'm on mute. Sorry. Thank you, Dr. Mishra. A very formative presentation, and I do see some questions coming in. If you guys have any questions, go ahead and send them in now, and we can start to answer some of them for you. So let's see the first one here. Someone wants to know, how long does the procedure take?
So the laser portion itself is probably going to take maybe less than 5 minutes, but you're in the procedure room anywhere between 20 and 30 minutes. There is just getting you prepared, moving you from one laser to the other, and then all the final checks and adjustments that are done. So laser maybe less than 5 minutes, but between 20 and 30 minutes in the procedure room itself. As I mentioned, on that day, you'll be on site about an hour and 15, maybe an hour and 30 minutes.
Okay. Good question. And okay, here's another good one. It says, so am I awake during the surgery? And if I am, how do I keep my eyes open?
Yes, good question. Good question. So one of the things that we have all of our patients do is take one Valium, maybe sometimes two, but usually one Valium to relax, take the edge off. And basically, you take that before you leave the house. So by the time you come to our office, the LASIK suite, you're definitely more relaxed. Our goal is for you to be relaxed but awake. We don't want you to be fully asleep. We need you to be cooperative in getting the procedure done. But we don't want you to have pain. We do put numbing drops on the eye right before the procedure starts. And in terms of keeping the eye open, that's really one of the good things. It's really never a problem. We have instruments that we use to kind of keep the eye open. And frankly, the patient doesn't even realize what's going on at that point between the Valium and the numbing drops. So that's really not a concern, but definitely a very good question.
Okay. Oh, it's a good one. How long am I going to be off work?
So yeah, it's a good question. So we do the procedure on Thursdays, whether it's done in the morning or the afternoon. It is pretty much on Thursdays. And for the most part, most patients we advise, if you can, you take the rest of the day, Thursday off, Friday, Saturday, Sunday, then go back to work on Monday. Depending on your job, there are people who feel like they have to work the next day, and again, depending on your specific type of job, that is okay. But ideally, you're taking a few days off until Monday. Now, there are a few restrictions for 1 week, and so depending on what kind of job you do, if it's a bit more labor intensive versus a desk job, you might want to take a few more days off, just depending on your specific job. But it would definitely be not more than 1 week.
Okay, good. Let's see, it says my cousin had LASIK and said it felt like there was sand in their eye after surgery. Is that true, or does it hurt?
So that's probably the most common thing patients tell us. They feel like maybe something's in the eye, or a little sandy or gritty feeling, and usually mostly just for that evening time. And the vast majority of time by the next day, that's gone. Maybe if patients have it, a few patients have a little bit of that next day, but for sure 2 days later, that's gone. So I would not say pain. They might feel a little bit of pressure during the first laser that we do, but not really pain. And right afterwards, a little bit of that gritty or sandy feeling. That does happen.
Okay, cool. And I've heard that too from some people just for the first evening. But usually people are feeling pretty good even the next day. So
you can take a little bit of, if it is a little more than you want, you can take a little bit of Tylenol, Advil, and almost definitely that takes care of it.
cool. Oh, this is your favorite question. Someone wants to know how long till I can wear makeup.
Oh yes, the makeup question.
I love it listening to you answer this one.
Very popular question. So, when I say, not being a makeup person myself, but basically this zone right here, the eye zone here, I say no makeup for 1 week. And so I don't know all the products, but I just know right around here, don't use it. And then anything on your face or forehead, even the next day, you could probably use and be okay. But around the eye, we advise for 1 week after the procedure to hold off. Good question. Popular question.
It's my favorite one because I love watching you explain it.
Yeah.
It's the makeup here. Oh, okay. Here comes another question. Does the surgery wear off after a certain amount of years?
That's a really good question. So the basic answer for the vast majority of patients, meaning over 95, probably even 99% of the time, no, it does not wear off. There are a few patients out there who had LASIK in the earlier days, maybe in the late 90s, early 2000s, where we saw a little bit more of that. But with the current technology, that hardly ever happens. Now, what you should be aware of is even with perfect LASIK, after the age 60-ish or so, the average person can get other problems such as cataract. There's possibility of things like age-related macular degeneration. And so those affect different parts of the eye. So you might feel like your vision starts to be not so good, but it's very likely that it's due to something else. More birthday candles on the birthday cake, as I like to say, on the eye. So can it happen? The answer is yes. It tends to be quite unusual nowadays for LASIK to wear off. Good question.
Yep, very good question. We do hear that one a lot here. I'm gonna give another minute, see if anybody else has any questions or anything burning that they want to know about. Now's the time to ask. I mean, you do meet with your surgeon or Dr. Mishra at your pre-op appointment, but then you get to meet with the surgeon. Another thing too, I think important to mention too, is that Dr. Mishra, Dr. Ernst, the surgeons, they're always here. So they're always in Harrisburg, they're always in, or in Lemoyne, but they're in the local area. So I think that's important. And one thing that sets us apart from some of the other facilities is that you get to know your doctor and you know that your surgeon is always going to be here for you. So I know that's, go ahead.
Yeah, I was just going to say, because of COVID, I'm not even going on vacation now. So
That's true. He's literally just here all the time.
I'm always here now. So, but my hope is correct. Sometimes you hear of doctors coming in from a different state or a different town a couple hours away, and then you go back to some other doctor. And so that's one of the things we pride ourselves in our practice is that you'll have access to your surgeons at all times. There's always a doctor on call. Again, whether it's a weekend or weekday evening, we'll have access to if there's ever any problems. I tell patients, if you have a problem post LASIK, please don't go to the urgent care center or emergency room or your family doctor. Just give us a call. We'll figure it out for you.
Well, along with that, a good question too. What are some of the risks that can happen after surgery?
Sure. Yeah. Very good question. So first of all, LASIK is very good, very safe. I like to say, millions of people around the world have had it done and been very happy with it. I've had it done myself and been very happy. No glasses. So having said that, there's always any procedure anywhere on the body, including the eyes, there's always a possibility of some complications. The first two things I like to mention to everyone are what I call minor issues. And that is, number one, dryness of the eyes, and number two, glare and halo at nighttime. Now, everybody who has LASIK gets a little bit of that for the first 6 months. Again, dryness of the eyes, glare and halo at nighttime. It goes away in 90% of patients after 6 months, and continuing over time, but maybe 10% of patients have a little bit of glare and halo, a little bit of dryness of the eyes after 6 months long term. Frankly, I'd call that a minor negative for the overall benefit. Major complications are thankfully rare, less than 1% chance. Bad infection, problems with the flap, and some other things that could, possibly significantly decrease your vision. Very rare, less than 1% chance. Knock on wood, thankfully in our office, I'd probably say they're less than 0.1% chance of a major complication. So I'm not going to say it never happens because that's not reality, but the way I look at it is something you should be aware of, but that should not really stop you from proceeding with LASIK.
Good questions. So this is another question we get a lot too. What are your success rates? Will I see 20/20?
Right, yes, so very good questions. Everybody, of course, wants to see 20/20, and I frequently get patients saying, oh, can I see better than I do right now, better than 20/20? And I even had one gentleman ask if I could get him to see 20/10, which is close to like eagle vision. I can't be promising you those type of things. I don't really promise people what kind of vision they're going to get. If they're a good candidate, what I will say to patients is, I'm not going to promise you 20/20 vision, but I see no reason you can't get there. The fact is that the vast majority of patients, over 90%, do end up seeing 20/20 without glasses, without contact lenses. Some patients see even better. I'm definitely not promising anyone 20/15 vision, but of course there are people who can see that well. And our success rates in our practice, Dr. Ernst, myself, are, I would say, just as good, if not better than the national averages. Over 90 to 95% of patients are seeing 20/20 or better without glasses, without contact lenses. I can't promise that to anyone.
And that's usually like right after, I mean, not right after surgery, but it can be pretty quickly after surgery too, right?
Yes, that's correct, Hope. Within a couple of days, for sure within the first week, patients, we have lots of patients. We have lots of patients see 20/20 the next day, but within the first week, majority of our patients are seeing 20/20 or better.
Okay. Does anybody else have any questions or thoughts? I'll give it just another minute and see if you guys can conjure anything up. And maybe you could talk a little bit about, Dr. Mishra, about the laser suite and why it's so cold in there.
Yes, right. So patients often mention that the room is cold as soon as they enter. And so that's actually on purpose. When we designed this procedure room, the LASIK suite, a very advanced heating and cooling unit was placed and implemented, and multiple air conditioners, etc. And so the reason for it is that the lasers require a certain temperature, and especially the Victus femtosecond laser likes it cool. It itself puts off a lot of heat, and it likes it cool. So because of that, we have to have the room be kind of on the cooler side, and it tends to be below 70 degrees. And so patients sometimes feel a little cool in there. Thankfully, they're not there too long, and they do get used to it. But we actually pride ourselves on having one of the best LASIK suites out there, because we designed it to have very strict cooling and humidity levels, which is what gets you the best outcomes, really.
It's cold.
Oh, yes.
It's cold for me. But luckily I'm not in there. Next question just came in. Is it okay if you are diabetic to do the procedure?
Yes, very good question. So the answer is, if you have controlled diabetes, meaning your blood sugars are well controlled, and there's no other problems with diabetes in your eyes. Diabetes can cause eye problems. It can cause diabetic retinopathy. So we do a full eye exam to make sure none of that is going on. So if no diabetic retinopathy, no other diabetic eye problems, and your blood sugars are controlled, you can definitely have LASIK. But LASIK is an elective procedure. So if your blood sugars are going up and down or just high, then that's not something that we want to do at that time. So we just advise patients in that scenario to just, just come back for a consultation whenever their blood sugars are a little bit better controlled.
Cool. And the next question I can take says, is the next step in this process to schedule a consultation? And yes, that is your next step. So we're going to want to take a peek at your eyes at a free LASIK consultation. It is complimentary. So how we would do that, the consultation can either be done virtually or in our office. If it's done virtually, either way, you'll meet with our refractive coordinator and she'll go over all of the LASIK information for you, the pricing sheet. She'll go over details of the procedure. But she can do that portion virtually if it's more comfortable for you, or in our office. Either way, you're still going to have to come into our office just for 10 minutes to do a quick screening on your eyes, where we just take a quick peek. We look at your corneal thickness, we look at the shape of your eye, take a look at your prescription, and then we can determine if, based on some of your health history questions, whether we feel that it would be, you'd be a good candidate for LASIK. So from there, and those consultations are either done by Amanda or myself, and then we take a look at that. From there, we go ahead and get you scheduled if you're ready. And then once you do that, then you go into what Dr. Mishra was talking about with your pre-op procedure, and then from there going in for the surgery also. So I hope that answers your question. But yes, the first step is going to be to schedule a consultation and find out if you are a good candidate. You can call our office and ask for Amanda or ask for myself, Hope, and we can get you scheduled. Or you can go on to seegreat.net. It's right there on the screen for you at any time, and you can schedule your own appointment on there also. So it's pretty cool. It sends you a follow-up confirmation email, and if anything were to come up, you can actually even reschedule from there too. So
I encourage you to come in for that consultation here. It'll, give you a chance to, see our space, see our facility, get comfortable with our staff, get comfortable with, everyone around here. I think hopefully you'll have a warm experience. I think you will, and I think it would encourage you to have LASIK by coming here and meeting us.
Yep, and if you come in for your consultation and you're not completely ready to schedule, that's okay too. But at least you can find out if you're a good candidate and can or not, and you can stop thinking about it if you're not. But most people are a good candidate. I would say probably maybe 10% or something. But obviously we're not going to do surgery on if we find anything that could be risky. But for the most part, most people pass the test, except me, of course. So I have to retest, but okay. Well, is there any other questions? I'll give it just a minute.
One of the things I'll just mention is, sometimes people ask about reading glasses. I will say, so, if you're younger than 40, you're not really wearing reading glasses or bifocals. So if you do have LASIK, I do try to make sure everyone understands that if you do have LASIK, you'll become like an average-eyed person. Average-eyed people somewhere between the age of 40 and 45 start needing to wear reading glasses. And so that does happen. And most people are so excited and happy to get rid of their distance glasses or their contact lenses that they're willing to, that's something they're willing to do and accept. And some people who are above the age 40 who've already been doing monovision with contact lenses, I mentioned earlier, one eye for distance, one eye for up close. Again, we can build that in with LASIK. So that's a great option. And of course, if you're not wearing glasses at all, other than just for reading, you're above the age 40, then this option of creating monovision is there. Some people like that, some people don't, but it is something that we can trial with you, try to simulate with you if there's an interest.
Yeah, that's a good point, because there's a lot of people that come in and they'll ask, you know, that they're starting to lose their reading vision, and that can happen whether you have LASIK or not, right?
Yes, yes, exactly. So there are times where if somebody's close to 40, maybe 41, 42, haven't really started wearing reading glasses, they get LASIK done and they start noticing a little bit more difficulties with their reading vision. That can happen. Easily corrected with reading glasses. I'm starting to experience that myself now, but more birthday counts than birthday cake, as I like to say.
Yeah, that's true. Plus, reading glasses are affordable, and you don't have to wear glasses all the time. So that's cool, for sure.
Yeah.
Okay, well, if I don't see any other questions coming through, so, if there's something you think of that is a question that you have, maybe you didn't ask or maybe you didn't get a chance to today, feel free to send us an email or give us a call. You can reach us at LASIK@seeGreat.net. If you did want to send an email, go ahead and send us your phone number. We'd be happy to call and answer your questions personally if that's more comfortable for you. So after this webinar, once we get off of here, I do want to let you all know that I'm going to send a follow-up email you'll receive, and it's going to have like a little survey questions on it, and that's just to see how we did, or see if maybe there's something that you would find more beneficial or something like that. Just a little bit of feedback on the webinar, and then with that survey, once that's completed, then you'll receive your coupon for the $199 off of the pre-op that I told you about. I'm also going to go ahead and put your contact information in the system now to let our refractive coordinator know that you are eligible for that LASIK discount until the end of September. And again, that would be $500 off per eye. And that is, you just have to schedule your surgery for the end of September. So I wanted to mention that. And then you may receive a call from a LASIK coordinator next week. Also, I just want to let you know, just to see if you do have any questions or you are interested in scheduling, if you haven't already scheduled. Again, you can schedule yourself a consultation free of charge at our website. And I guess that's it for today. So, Dr. Misher, I want to thank you so much for your time tonight and all the information and answering all the questions.
Yeah, well, thank you, Hope. Thank you for help setting this up, and thanks to the audience. I hope you enjoyed. Hope we answered your questions, and we look forward to seeing you hopefully real soon, doing some LASIK.
Yeah, come in and visit us. Come in, check out the suite, and schedule a consult. So hope to see you guys soon. Thank you. Bye.